So, what are the three main causes of lower back pain? Well, there's a number of different reasons why people get back pain. And the most common ones are, well, there's a variety of factors that will cause them. Now, one, it could be a muscular strain or a sprain. One cause of that is when the muscles or ligaments in the lower back get strained. It often occurs if you lift a heavy object improperly, like at the gym. You've done sudden movements, maybe like in terms of a powerlifting class, things of that nature, or just in the garden, you've lifted some heavy things and moved them quickly, like muscle spasms and difficulty with moving. I don't have a problem with muscle spasms. In fact, I think muscle spasms get a bad rap. They're a good thing because they prevent further injury. That's why it spasms and clamps down. Of course, it's not comfortable when you feel a muscle spasm. And that's a good thing too, because you kind of want the body to go, hey, dude, stop. Like, chill out, stop doing this thing. Let me heal, let me recover. Let me stop you from getting hurt more. So muscle spasms, for that reason, are a good thing. Although one of the things that are a challenge is that you could, once you resolve the original issue, that the muscle spasm sometimes hangs around a little bit. So sometimes getting rid of that muscle spasm can be a challenge. The second common reason for getting back pain is a herniated disc, commonly known as a slip disc. And there's different types of herniated discs. But really, when you get a herniated disc or slip disc or ruptured disc even, the discs in the spine, in fact, I've got one right here. So this is what bones in the spine look like, and these jelly bits between are the discs. And they have two parts. You've got a nucleus in the middle, like a little bit of a jelly part, and you've got a fibrous part on the outside. And so the idea is that if you get too much movement, in fact, more commonly, the causes of a herniated slip disc is when you get sustained pressure over a long period of time. So we're talking about sitting down for many, many, many years can gradually make the disc bulge out. That's a more common reason than, for example, trauma, like an accident. But that's another thing. Now, if that disc bulges out and starts pinching his nerves, then where those nerves supply, that can often cause tingling, numbness, weakness, order sensation, things of that nature, even shooting pain as well. And then the third one that we see commonly here is arthritis, or specifically osteoarthritis. So arthritis is a very broad umbrella term, and it means arth refers to joint and itis being inflammation, so inflammation of a joint. However, there's many different versions. The most common one that we see is osteoarthritis, which is degeneration. In fact, I've got a great model here that shows exactly that in the spine. So you can see that you've got a normal textbook spine here, and as time continues on, it can wear down and cause degeneration in the joints. However, having said that, people often mistaken degeneration as an old person's thing, whatever that means. But actually, degeneration starts in our 20s. In fact, if you think about as we were growing through birth, through our life, we're kind of growing, and then we get to a point where we stop growing. And it's that point that we start degenerating. But the rate of that degeneration is something that we can affect by adopting healthy lifestyles and make sure you do all the right things, getting care for massages and adjustments and things of that nature too. That's important too. There are so many other causes of lower back pain. And so when you see the signs of an advert saying, here's the cure to back pain, you should have alarm bells going off, because there isn't a cure to a symptom, there's only a cure to disease. Symptoms are due to a result of many, many different conditions. And so the idea is to make sure that you get the right treatment for the right condition. And therefore, that starts with a good diagnosis. And that starts from a really in-depth initial consultation, which is why if someone was to come and see me, they don't just straight away. We need to go through a case history, an examination, a full diagnostic procedure before we can then say, yep, this is the treatment we're going to apply. I hope that's useful to you. If you have any questions, please do leave me a comment. I'll be happy to answer any of them. Otherwise, in the meantime, I wish you all the best. I hope you're having a great start to the new year. And this is my first day at the clinic, back at work. And it's been great.